Okay, guys, now this afternoon I have discussion D for you, which the title is "We Are Turning Too Many People into Medical Patients." Okay, I'm going to explain that title for y'all. The surrounding page frames the text. We are turning too many people into medical patients as a critique of modern healthcare, modern healthcare's tendency to overdiagnose and over medicalize. It argues that medicine has drafted into labeling everyday variations in human behavior, risks, and development as disorders, thereby transforming large segments of the population, especially children and otherwise healthy adults, into patients, raising rates of diagnosis such as ADHD, autism spectrum disorder, and pre-disease categories like prediabetes. Or mild cognitive impairment are presented as evidence of this cultural and systematic shift. The central concern is that medicine has become less about healing and more about finding something to treat, even when the benefits are uncertain. What drives the shift? Broader diagnostic criteria. Medical definitions have expanded to include milder, borderline, or transient cases. This diagnostic creep means more people qualify for a label when their condition may not cause significant impairment. Screening and interacism, the filtration of tests and early detection campaigns uncovers incidental findings and pre-disease states. While intended to prevent harm, these often trigger cascades of follow-up appointments, procedures, and treatments that may not improve outcomes. Health systems initiatives, free-for-service models, reward more testing and diagnosing uh, defensive medicine driven by uh, liability concerns also encourages clinicians to err on the side of labeling and intervening. Cultural expectations. Patients, educators, and parents, educators, and patients often seek certain uh, certainty and quick solutions. Serenity and quick solutions. Medical diagnosis provide a sense of clarity, but they can substitute for social, educational, or environmental supports that might be more appropriate. Consequences the page highlights. Harm from overtreatment. Unnecessary medications and procedures expose people to side effects, complications, and psychological burdens without clear benefit. Identity and stigma impacts. Being labeled as a patient can reshape self concept, stigmatize normal variation, and shift focus away from resilience or adaptation. Resource diversion. Healthcare dollars and clinician time are consumed by low value care. Reducing access to those with urgent medical needs. Diagnostic inflation. Rising diagnosis rates are sometimes celebrated as progress, even when they don't correspond to improved health outcomes. What the page is not seeing, not anti diagnosis. The critique acknowledges that medical labels can be life changing when they connect people to needed supports and treatments. Not no care. It supports evidence based medicine and emphasizes the less is more movement, which seeks to reduce low value interventions while maintaining access to necessary care. The proposed collective tighten thresholds and definitions, ensure diagnosis are tied to clinically significant impairment rather than mild or temporary variations. prioritize outcomes over labels, measure success by improvements in quality of life, not by the number of diagnoses made. Adopt less is more practices, encourage shared decision making, reduce unnecessary testing, and reserve treatment for cases with strong evidence of benefit. Strengthen non-medical supports. Invest in educational, social, and community resources, particularly for children, so that challenges are not automatically medicalized. Bottom line, the page insists that diagnosing more people does not equate to healing more people. Instead, it calls for recalibrating medicine toward justice, judicious care, cleaner diagnostic standards, and robust non-medical supports. By resisting the urge to normalize human variability, healthcare can avoid turning everyday life into a lifetime of patienthood and focus on interventions that generally improve well-being. Okay, guys, that's your shows for the night. If I feel like jumping back on and doing extras, I will, but for now, Gator Wellness, take care, folks.